There are medical breakthroughs and incredible work happening in our local hospitals, and I'd like to welcome to the studio Dr. David Levi from Atrium with us to talk about a first-in-the-world liver procedure that is really promising for patients who have cancer in their liver. Can you explain how the team of doctors at Atrium have come together to develop this procedure and the promise it now gives to patients?
Thank you. We have a number of patients that we see where what's limiting our ability to remove a tumor in the liver are technical issues. It's not that the biology of the tumor is not amenable to surgery. It's not that they're not good candidates for surgery. It's just that there's technical limitations. And more, really as liver transplantation has evolved, we now can apply some of the techniques we do on a daily basis in a non-transplant setting to remove certain liver tumors.
And so in some situations, you're almost combining two procedures together?
Yes, a lot of this is collaboration of different teams. So we're very fortunate here in Charlotte. We not only have our transplant team, but we have really outstanding liver surgeons, non-transplant liver surgeons, hepatobiliary surgeons, and anesthesiologists, and an operating room staff, and an ICU staff. And really we have to work together in order to do something like that in a way that is integral to it. It's really a collaboration of teams.
So you may actually remove a patient's liver and in the operating room perform an operation on that organ and then put it back.
Yes, so these handful of cases that we're discussing involved removing the patient's liver and then at a separate, we say back table, separating the tumor from the liver and then reimplanting, auto-transplanting the remnant liver back into them. So it's an application of transplant techniques to remove that tumor.
And have you seen patient success with procedures like this?
Yes. When it works, it works. It's an option that it's not often thought of a lot of places, but when you can apply it, it's when there is really no other option. So when it works, it's great because it's a situation where the alternatives were not. There weren't good alternatives.
And I know there have been a couple of patients already willing to share their stories of how the doctors at Atrium helped save their lives. When it comes to recovery and ability to live a full life after something like that, can you?
Yes, these are special patients who are in very good shape for surgery. This is not a minimally invasive procedure. And that's what's interesting maybe is there's the spectrum of different procedures from the very minimally invasive to this, which is really a big operation. But in the right patient, they can recover. The liver has certain regenerative capabilities. It can grow, so we can replace a small piece and it can grow within weeks to its normal size. So when patients can recover, they have a full recovery. Wow. When it works, it works.
That is remarkable. Dr. Levi, thank you for the work that you do at Atrium, and thank you for sharing more about this medical breakthrough with us.
Thank you.